Welcome back for another episode of Civility Wins, the Family Law Edition. I am your host, Kristen Goss, founder and owner of KWG Family Legal and Mediation Services. We are your knowledgeable, warm, and gracious attorneys, and we help spouses divorce with civility, creating a legacy for those they love most. And I have with me a good colleague, Ann McGuire, with Healthcare Pathfinder. And before we get into the discussion, just wanted to give a brief bio of Ann. So, Ann McGuire is the founder and owner of Healthcare Pathfinder LLC. It is a national health and long term care advice, advocacy, and management firm. For 25 years, Ann has been working with individuals, families, and employees to help them maximize access to the care and coverage they need and deserve. She's a registered nurse, a certified case manager, and she has life and health insurance licenses, but she doesn't sell insurance. She is a broad, multidisciplined background in the healthcare arena, including EMS, intensive care, home care, managed care, and appeals negotiation advocacy. Currently, she serves on the Aging Life Care Association New England Board, and she's a member of the Case Management Society of America. She resides in Darien, Connecticut with her husband. Thank you for joining me, Ann.
Thank you so much for having me, Kristen. It's great to be here.
Yes, well, great to be here and to have this conversation, which I think is extremely important. So I'm excited about what we're going to talk about. And my first question to you would be tell the audience a little bit about yourself and how you ended up getting into what you do.
Well, I can sort of, based on getting into the health insurance industry or even the healthcare industry. So how I started out was when 14 years old, we had a volunteer ambulance corps in our town. So I joined this volunteer corps and started riding the ambulance at 14 and became an EMT, which is a certification that most people get at 18. We got it at 16 and then started driving the ambulance. And so it was really great. And then kicked me into going into a healthcare track with becoming a nurse, a registered nurse. And then I started in surgical trauma, intensive care, home care, managed care. When you talk about the home care to managed care, some people might not understand that part of it. That's when the insurance companies really started getting involved in managing the care, and as far as approving it and authorizing, denying services. And so at that point, that's when we were moving. So I jumped and went on the other side. I said, I'm going to learn about how the other side works. So it was really wonderful working initially at the insurance company. But then they trained us to be certified case managers, and I ended up working with 3 large medical groups and helping them understand. It was both the financial side and the care side. So it was really interesting to see the impact of the physicians, the medical side, really understanding how much things were costing when patients were in the hospital. So we were very proactive in managing the care, and it was really a wonderful experience. And then we moved again, and I ended up joining a company that was this woman was just starting a new firm that was really healthcare advocacy. And it was before the Affordable Care Act. So we were very focused on helping people with getting their insurance because there were pre-existing conditions. So it was very challenging, and a lot of claims being denied and claims management, all of that. So now it's evolved into much more of the really helping people understand their insurance options. And I'll share more about this later, but their insurance options and, really needing that advocacy to maximize access to their health insurance benefits.
I love it. And I wish I knew you 15 years ago. Yes. Unfortunately, I lost both of my parents, my mom in 2010, She was 59 to uterine cancer, and my dad in 2014. And so from 2010 to 2014, I was my dad's caregiver. And my mom was a veteran, so he had Champ VA. I'm not sure it's
Yes.
this called the same thing at the time, but to navigate all of that was a nightmare for me
Right.
to ensure, because he had dementia as well, so he wasn't able to really know what was going on, and so I had to be his advocate, but knowledge is power. And so I'm really excited that we're going to have this conversation, because I'm sure there are a lot of people out there in the audience that can relate. They are probably that sandwich generation where they're caring for a loved one or a parent. And it can be very challenging, and having the additional support and the knowledge is key. So thank you for being here and for sharing the information you're going to be sharing, because it's very important and needed. Um, and so I'm going to take a little step back and deviate a little bit, because I am a divorce attorney, as you know, and oftentimes when it comes to handling the settlement agreement, there's the life insurance and the health insurance aspect of things. And when people get divorced, you're no longer on your spouse's insurance. There's a lot of transitions going on. Can you talk to the audience? There may be people out there who have questions, maybe contemplating a divorce, and want to know some of their options when it comes to that from the health insurance side.
Sure, sure. Well, what I always say, it's really great to be thinking about this. I know people generally think about it before they go through the divorce, but it depends on where you live and what state you live in as far as the impact
Mm.
and what kind of benefits. If you're the one losing the benefits, maybe it's like company, great corporate benefits. That can be very difficult when you're transitioning to look at COBRA, which can be seem very expensive. But then when you start looking into the marketplace, that's the individual plans, which are very state specific.
Mm.
And that's when it gets confusing, because you sort of say, oh, well, I'm a very healthy person, or I none of my doctors accept insurance and I'm filing bills for out of network benefits. Well, a lot of those go away
Mm.
down at, when you start going into the individual marketplace. So what I do suggest is for people to look closely at what they are paying, like what are those benefits? What do they look like? How old are you? Do you have Medicare coming down the road? But even looking at those costs, because people think, oh, great, Medicare, it's free.
Mm.
It's not. It's now gotten very expensive. So it's really looking at all those, looking at the out-of-pocket costs, and really working with your attorney to know what to ask for. So when you're on the other side, you're not throwing your hands up and putting, saying, oh my goodness, if I had only known.
Mm. Mm-hmm.
Um, and then having the support as you're going through that on the other side. But I do say, I did it with a client. We did a whole spreadsheet comparing current coverage, the options, and then what was going to be down the road. And then also I do, and I'm sure you do as well, is talk to people about getting long-term care insurance potentially before the divorce, because you can get some nice discounts depending on the type of policy. So that's a real benefit. And if you may end up on your own.
Mm-hmm.
So it's the long-term care is really very important for choices, and something to talk to your kids about as well.
That's awesome. It's the theme here, I believe, is proactiveness, knowing your options. And I'm glad you mentioned long-term care, because being proactive can save thousands of dollars down the road. My dad, unfortunately didn't have long-term care. And so we had to pay out of pocket for an aide to be there during the day, 8 hours a day. He was fortunate enough to be able to do that, but most people aren't. And my husband and I ended up having to move in with him for the 24/7 around the clock care. But long-term care insurance is important, as you know, and can imagine up in Connecticut, it's similar. A
Right.
nursing home, for example, can be anywhere from $10,000 to $20,000 a month,
Right. Yep.
depending on where you're staying. So being proactive and making sure you have your options and you don't wait till the last minute is key, for
Right.
sure. So my other question to you is, what other areas of transition can you assist with, for the audience out there? We talked about divorce and ensuring you have the right coverage before, you sign on the dotted line and you're no longer living as a married couple. But what other areas do you help with?
Well, there's so many, and some people probably don't really think about them that much, but we call them really life-changing events that impact your health and long-term care. And this could be, the retirement, loss of a job, loss of a spouse, moving to another state. When you go through these different or significant illness, that's not necessarily at that time can you transition or change your insurance, but it's knowing the opportunities that you may have down the road to change your insurance. So we do many, we assist people with many transitions. We place insurance, we don't sell it. We can refer to brokers, but we can actually enroll people directly in plans. So we'll consult with people on what their options. We'll look at and compare the current coverages that they have or had to see what we can get to support them on the other side. And during the open enrollment period, people, again, they sometimes just think that they'll just stay on the same plan, not realizing that their networks may have changed, their provider networks or may have gone out of network. And there's no guarantee on whether they stay anyway, but there's a really a wide range. Another area of helping people with transitions is often, mom is in the hospital and her Medicare Advantage plan is denying her to go to that acute rehab. We just had this happen with a client recently. And what we did besides the appeal, they still denied for her to be able to go to the acute rehab. But what we were able to do was get her off of the Medicare Advantage plan and change over to original Medicare with a supplemental prescription drug plan. Unfortunately, in Florida, that's not so easy to do because you have pre-existing conditions, exclusions when you go, if you want to get a Medicare supplement plan. So then you end up with a fair amount of out of pocket, but I've had clients who were willing to do that because they wanted to go to a certain hospital in Cleveland, but they couldn't do it on that Medicare Advantage plan. So I could talk for a very long time.
No, I love it.
So many different scenarios. Yeah. But the key I say to people is if there's something impacting that health insurance, what can you be doing? What should you be doing? When are your opportunities? And then one other thing that I'll say is the Medicare transitions are very important to understand how to do the enrollments at the right time. And it gets very complicated after people have turned 65, they've still been working. They often do deals, it's sort of, retirement. They'll take a retirement package or things of this sort, not realizing that they still needed to enroll in Medicare. And then they end up with penalties going back years. So it's a timing and just really asking.
That's awesome. Thank you for sharing. Yeah. My next question would be, what one piece of advice would you give someone who's kind of on the fence? Because we talked about being proactive a little bit earlier. And unfortunately, human nature, sometimes we don't act, or we say, oh, yes, I'm going to get that done. I'm going to get that done. And we don't do it. And then it's too late. So if someone's kind of on the fence out there and maybe not even kind of like decision, they don't know which way to go sometimes, so you don't act because you don't know which way to go. So what is one piece of advice would you give someone who is on the fence?
I would say, well, first thing I'd say, don't look at the premium for you to make that decision. You really need to look at the benefits. So I think what's important is to be thinking about the one piece I would really say is really looking at your benefits and comparing them to looking at all of your options, and honestly talk to a broker, to speak to professionals, to make sure you're making the right decision. It just can really be a major impact if you go down the wrong pathway. You just can't necessarily change back until next year. So that, and looking at your networks. And I'll just give you an example of being really careful. Is we just had a client call. Their son had lost his job, and he enrolled, and he thought it was like a marketplace plan, went online, but ended up getting steered the wrong direction. And he enrolled in sort of not a real insurance type of plan. He had a horrible accident, and they have a $60,000 bill because it was sort of fraudulent coverage that only covered a certain amount. And he didn't realize and they were paying $400 a month. So it was definitely, shouldn't have been paying that much. So they're, fortunately he's doing okay, but they're saying, what can we do with this bill? And I'm saying, you can file a complaint with the state and negotiate with the insurance company. Man. So yeah, it's just beware, and trying to do it yourself. You might want to talk to a broker for free first before you start trying to do things yourself.
That's great advice. That is great advice. Thank you.
But this broker was fraudulent.
That's
referred to. So you have to be careful.
So sad. But I'm glad the son is doing good.
Yeah,
that's good.
Yeah, exactly.
And
so I should circle back and be clear. It's like the advice would really be, I'm going to give don't just look at the premium. Really make sure you know what your options are, and don't just sign on without understanding what you're getting.
Great advice. Great advice. And so we have the audience here. Ann McGuire, she's the healthcare guru, healthcare expert. Where could if people had questions and they wanted to learn more about you and reach out to you, where could they go to find you?
Well, a great place to go is my website, which is healthcarepathfinder.com, www.healthcarepathfinder.com. And you can also call our number, 888-511-0128. And extension 101 is me, but I'd try 104 to get Ginny. And then you can also email us at info@healthcarepathfinder.com. And if you go on our website, actually many clients come to us that way. We've got a contact information, and you can just send us an email through our website. But our website's great information, so it's a nice place to go.
Awesome. Contact her. That's Ann McGuire, everyone. Thank you for joining me. I really appreciate your time and the wonderful advice that you have to give. I'm sure that you're able to help many out there who are listening in today. So thank you so much.
Thank you.
You're welcome. So that is another episode of Civility Wins, the Family Law Edition. I am your host, Kristen Goss, founder and owner of KWG Family Legal and Mediation Services. We are your knowledgeable, warm, and gracious attorneys. Until next time, take care, and don't forget, share, like, and subscribe to this YouTube channel. See you next time. Take care.